Public policy shapes our healthcare system and the delivery of care. It impacts how patients afford and access care, how doctors and hospitals are paid for the services they provide, and how research is funded. While public policy is developed and enacted by government officials, it is influenced by advocates like yourself. Legislators often work with their constituents to learn about social problems that can be fixed through public policy solutions. Since the establishment of the nation's registry, NMDP continues to advocate for public policies to advance equal outcomes for all blood cancer and blood disease patients.
I think when a lot of people hear the words public policy, they think of something boring and dry, but the work that we do is really connected to the patients that we work with.
One of the most misunderstood things that I think people don't consider about public policy is how government agencies or entities at all different levels, federal, state, and local, depend on community organizations. Legislators rely on advocates to provide information that they would not otherwise have to make impactful changes. I do feel like everybody can make a huge impact on public policy. You just have to get out there and make it happen.
The Stanford BMT program, and me as part of it, works with the NMDP in many ways. Public policy and the laws created to benefit our patients have helped us on a day-to-day basis.
Some of the most impactful work that we do is done at the state level. One reason we work on both state and federal policy is because at the state level, we can make changes more quickly than we can at the federal level. States are a great way to see if a policy is going to work, to see how people react to it. There are also some things that can only be done at the state level. Medicaid, for example, I worked on a campaign to require Medicaid to allow access to clinical trials. It's really important to make sure that people have all the options that they can to be treated for their disease.
When we go to Congress, we remind them that we've been in partnership for 40 years, and we want to be in partnership 40 years after that, because this relationship works. We have been helping over 120,000 patients find their life-saving match, and we want to do that for 120,000 more patients, and 120,000 more patients after that. Because we're good at what we do, and we can work with Congress to make sure this keeps happening and that we will continue to democratize cell therapy.
I've enjoyed working with the NMDP in many different ways, both through my job as a marrow donor, as a courier at one point, and also through advocacy. And having done it now for many years, I see the improvements we made, and I would know that it wouldn't have been done without the laws that we've had passed and the support that we've had from Congress.